Okay, we are live at the HealthCare Nigeria event 2018. I'm at the exhibition stand of TremenDoc. Well, we'll be speaking to Chikezie, the CEO of TremenDoc. Sir, please, could we meet you and know what your brand is all about?
Okay, like I said, my name is Chikezie. TremenDoc is a telehealth solution that allows our users, patients, get basic consultations from licensed doctors. So the solutions allow you get this consultation via chat, audio, and video calls. So we have doctors signed up across Nigeria, and they are able to use this platform and make themselves available on the platform so they can have consultations with patients on the go.
Okay, I noticed in Nigeria the trend now is more of tech. What do you think, or what do you say about a proliferation of telemedicine or telehealth, which you are an operator in? Do you think it is hygienic, or do you think it is good that there is so much of telemedicine companies, and does it necessarily translate to success when you get new players coming into the field?
Healthcare in Nigeria is really terrible. Let's call a spade a spade. So we're solving two problems. I like to say it like we're solving two problems. One, access to healthcare. A lot of people, you'll be amazed how much people do not have access to quality healthcare. So what telemedicine does is, as far as we have, bearing in mind that Nigeria is the most mobilized nation in Africa, with the highest amount of internet penetration in Africa, we're taking advantage of that with that number, and then we're allowing people get access to healthcare using what is available to them. We have a lot of smartphones in the country, smartphone usage, internet usage. So what we're saying is bring affordable healthcare through the medium or the media that people are already used to, and get doctors to them. That's one. Secondly, we're also solving the problem of not paying our doctors well. Doctors are not paid properly. And that's why we get a huge number of them leave the country and work in diaspora. We have a lot of doctors in the UK, in America, and Dubai. Now, what telemedicine would do is doctors are paid per consultation. So for every consultation they make, they get paid. Unlike when they're in the hospitals, so they're paid little or nothing. And then they do 1,000 consultations and they get paid a fixed amount at the end of the month. So telemedicine will help bridge that gap where doctors are able to make some extra buck with what they get as a normal salary. So coming to your question about having a lot of telemedicine products in the scene, we welcome it because I don't think it's enough. We're 180 million people. I would say in the forefront we have company like TremenDoc in the forefront. I know that a lot of other telemedicine companies are there, but some of them are not even as privileged as we are. So they are still trying to struggle in that market. It's not. I think the amount of telemedicine solutions in the country is not even enough for the kind of problems we're trying to solve.
Okay, are you seeing conversions? When I mean conversions, I mean our patient usage. Are patients actually using your platform? And what are your challenges, your most critical challenges you experience operating?
Okay, so telemedicine is still quite new in Nigeria, and there's still a lot of education to be done. But we have people use it. It's amazing, the response. I've been in the technology space for some time with other products I've launched, and this is the first one that we launched that really seems to be solving, like, the reaction we got from people means that there has been a huge void in that space in January. The response was amazing. We had over 1,000 downloads in one week without proper marketing. So word of mouth, you have people, it's almost as if they were waiting for it to come. So I mean, when you know a fantastic product is when you don't need to market, and then people are calling in, how did they get the support number, you know, the people are going there and checking it out, and you know, calling. We got emails of people saying, oh, I can't reach your doctors are unavailable, what's going on? And we try to educate them and make them understand that sometimes doctors go off because they have other things they're doing. It's almost like, pardon me to use Uber as an example. So where you have drivers, these drivers are like doctors, so they make themselves available, they make themselves unavailable. We're looking at a situation where we have a large ecosystem of doctors, where at any given point in time you have a doctor available on the platform. But when it comes to users and their acceptability of the product, it's been amazing. Yeah. So critical challenges. So we're still trying to get there. Number one, some people, the mentality of the people. Sometimes they feel like, oh, these doctors should come to their homes. There are different services that TremenDoc provides. So when a doctor consults online, they expect that, oh, this doctor not coming to my house. What else? Are you giving me the drug as well? You know, that's one. Secondly, there's still, even as much as we have internet penetration, there's still other places that do not have good internet. You know, this technology works, depends on your internet, which, because of the audio, the video, and the chat that you have to do, even though it's internet penetration in Nigeria has been good in the past couple of years, we still have a long way to go. That's one. Secondly, we still also need to have a situation where most of our challenges is getting some of the medical bodies to work with us, so that we can get more doctors on the platform, and then we're able to vet them, you know, with these bodies, you know, and I think that's just some of the challenges that we have, apart from the regular funding, trying to market across Nigeria and all that, which I feel like every company or startup goes through. So that's
okay. Yes, you consider yourself a startup group?
Oh yes, TremenDoc is a startup. We just launched January, so we are a startup. Yeah.
Okay, I'm very happy to have spoken to you. You are doing wonderfully well. I think it was in another health event. I came across your activities, although in passing. Okay. So when I came around and I saw this, I said we should also interview this. I think I need to encourage telehealth companies who are doing what you are doing. I think that's the next phase in our healthcare sector. So thank you once again for speaking to us. Chikezie, yes, the CEO of TremenDoc.com.
Thank you.